MDTV Medical News Now is a program dedicated to bringing you the latest in medical treatments and technology with insight from select leaders in healthcare that are in your hometown. In today's edition, for many women, pregnancy is a happy occasion, but pregnancy doesn't automatically conclude with a healthy birth. How can you protect yourself and your unborn baby? And who likes going to the dentist? Does it make you feel anxious even thinking about it? Well, some dentists are hearing your concerns, and they've got some answers you may find very relaxing. Later, 13 million people in the United States suffer from urinary incontinence, yet 75% of women never seek treatment. Many products on the market treat the symptoms, but some doctors are going right after the cause with less invasive procedures. And finally, in 1960, the incidence of breast cancer was 1 in 20. Today, it's 1 in 7. Are you doing all you can to protect yourself? Stay with us. MDTV Medical News Now is next. That's great. And the top here.
Patient-doctor relationship is obviously very important. Should a potential patient ask?
That's an excellent question, Pat.
I'm Renee West, and you're watching MDTV Medical News Now. A healthy pregnancy begins before conception with good nutrition and a healthy lifestyle. It continues with appropriate prenatal care that includes the prevention of complications. Technology such as ultrasound has made amazing strides in the detection of abnormalities and evaluating fetal well-being. Now, let's hear from an MDTV Select expert in your area.
There's various ways that ultrasounds are important for looking into infertility problems. So the ultrasound is helpful in monitoring development of eggs in a patient who's undergoing stimulation with fertility medicines. The main causes of infertility are, number one, male factor. There are men who've had trauma to their testes or have genetic abnormalities which result in decreased fertility potential. The second, one of the other major second causes is tubal damage. Unfortunately, in the United States, many women develop infections in their pelvis, and some of those go asymptomatic. When that happens, the tubes are damaged, and when the fallopian tubes are damaged, there's difficulty conceiving. So really what we do here is we look at the individual, analyze the details of what their problems may be, and then we tailor their treatment to what they have.
For somebody like me who can't get pregnant on my own, it's just such an amazing joy to know that I have 2 beautiful children and that this process is available. I have a 2-year-old and I have a 4-month-old, and they were both conceived through IVF. The first one was a fresh cycle and the second one was a frozen embryo, actually.
At the Reproductive Medicine Group, we have a full-service office within a laboratory that's integrated into our office, where blood work, including estradiols, thyroid, and other important hormonal studies are done. We also have a surgery center, which is in North Tampa, which deals primarily with fertility patients and their problems. We also have a laboratory, embryology laboratory, which also focuses specifically on in vitro fertilization, embryo transfer, and gives us the ability to have extremely high pregnancy rates with in vitro fertilization embryo transfer.
I can't say enough about everyone that I was involved with, from the doctor to the ART nurse to the surgery center. Everybody was just caring and empathetic and seemed to know exactly what I was going through.
Going through fertility treatment is extremely stressful and extremely emotional. And what we try to do here at the Reproductive Medicine Group is look not only at the physical but also the emotional. We have counselors here. We also have patients who have gone through fertility treatment and are willing to help patients who are starting fertility treatment.
If you're having trouble conceiving a child, please consider calling the Reproductive Medicine Group. The results are just absolutely amazing, and as you can see, just truly miracles.
We have a great website that has a lot of information, and it's floridafertility.com.
We take a closer look at today's ultrasound right now on our MDTV Medical Moment.
Ultrasound has been used in a variety of clinical settings, including obstetrics and gynecology. The purpose of ultrasound is to allow the physician to view the anatomy of the fetus without the use of radiation that could damage the delicate tissues and organs as they form. There are 3 basic types of ultrasound: 2D, 3D, and 4D. 2D provides a slice or cross-section view in real time, consisting of height and width. 3D ultrasound provides height, width, and depth by combining anywhere from 2 to 300 two-dimensional images to form the 3-dimensional picture. The addition of this third dimension gave doctors the ability to assess the development of the fetus, especially the face and limbs. Because the rendering of all these views to form the 3-dimensional image can take between 3 to 5 seconds, the final result is more like a still photo. 4D ultrasound combines the best of 2D and 3D by producing a 3-dimensional view in real time, allowing the physician and parents to see the unborn child in motion. The main advantage of 4D ultrasound is that it permits the doctor to examine moving organs such as the heart and to determine proper blood flow within the organs. The evolution of ultrasound shows great promise in that physicians will use this technology to plan treatments and even guide surgeons through their procedures. I'm Sean Doran, and this has been your MDTV Medical Moment.
If you have any questions on this MDTV Medical Moment, please visit mdtvselect.com. We've got a lot more to cover when we come back, including a relaxing trip to the dentist. Is it possible? We'll also explore the cause and treatment options for urinary incontinence. And later, 8 out of 10 breast cancers diagnosed are in women over 50. How can you best protect yourself? MDTV Medical News Now will return shortly.
If you would like more information on this topic, please visit our website at mdtvselect.com or contact a select expert in your area.